I am a nurse at OSU in the Ross Heart Hospital. I work on 2 ROS, which is the cardiac medical ICU. We focus on patients that come in post-arrest or heart attacks, STEMIs, and we provide ICU level care to them. I came to be a nurse as a second career. I was born with a congenital heart defect, so I knew that when I went back to school for nursing, I knew I wanted to be a cardiac nurse. So I went back to school and focused on some projects for cardiac and ended up as a cardiac nurse. We actually had an increase of central line infections, and we didn't know where they were coming from. So we decided I actually did a whole bunch of chart review trying to figure out what had changed, because we didn't have a whole bunch of new staff, we couldn't think of policies that had changed, and we realized that all of these infections were coming from one kind of line. It's a central line that we place to monitor pressures in your lungs and your hearts while we're adjusting medications to make sure that we're doing what your body needs. We were getting a lot of infections, and we realized that it's because we were leaving this line in longer, because we were working at more transplants and our patients were sicker and we were adjusting their meds more, and we didn't have a new dressing for this type of line. So my manager at the time gave me kind of full autonomy to go through all the catalogs of every company and find one, but there wasn't one on the market. So we made one. So I was at work frustrated, we weren't making any progress on our project. So I reached out to the Innovation Studio and asked for their help. When we came to the Innovation Studio, we knew what we wanted, but we didn't know how to make it a real dressing. Jordan and I, one of the physicians on our team, went to the Innovation Studio and told them what we wanted. And it was amazing because we both had different perspectives, me as the bedside nurse that manages it, and then Jordan as the physician. But the Innovation Studio was able to help us put those ideas together, and we created this dressing that we think will really make a difference. It's amazing to see your ideas come to life at the Innovation Studio. And I know that probably sounds cheesy, but to have a problem with real data that you know is like impacting your patients in a real way, and then to leave the Innovation Studio a couple months later with a real prototype is incredible. And it's so empowering as a nurse. We're trying to refocus on finding someone to manufacture it and produce it sterilely for us. In 5 years, I hope to see my innovation in all ICUs. I want it to be on all the patients that have this line, eliminating their infections and keeping them safe.